Methotrexate is one of the most commonly prescribed medications in rheumatology, but it's also one of the most misunderstood. Many patients feel anxious when they're first told they may need to start methotrexate. Questions about safety, side effects, and long-term impact are very common. If you've been advised to start methotrexate or you're considering it, this video will walk you through exactly what it is, how it works, what to expect, and how we manage it safely. I'm Dr. Bhadauria, consultant rheumatologist at Pure Rheumatology London. Let's start with the basics. Methotrexate is what we call a disease-modifying anti-rheumatic drug, often shortened to DMARD. That means it doesn't just treat symptoms, it actually works on the underlying disease process. In conditions like rheumatoid arthritis, the immune system is overactive and causes inflammation in the joints. Methotrexate helps to reduce that inflammation and prevent joint damage. So this is not simply a painkiller, it's a treatment aimed at controlling the disease itself. One of the most important things to understand is that methotrexate is usually taken once a week, not every day. This is very different from many other medications, and it's something patients need to be clear about from the start. It can be taken either as tablets or as an injection, depending on what suits the patient best. Now, one of the most common questions is, how long does it take to work? Methotrexate does not work immediately. It typically takes several weeks to start having an effect, and often around 8 to 12 weeks to see the full benefit. During this time, we may use other medications to help control symptoms while the methotrexate begins to take effect. Let's talk about side effects, because this is often the biggest concern. It's important to say that many patients tolerate methotrexate very well. However, like any medication, it can have side effects. The most common side effects include nausea, mild fatigue after taking the dose, and occasionally mouth ulcers. Some patients also notice a reduced appetite or a general feeling of being slightly unwell on the day they take the medication. These side effects are usually manageable, and there are ways to reduce them. For example, we often prescribe folic acid alongside methotrexate. This helps to reduce some of the side effects, particularly mouth ulcers and nausea. If patients do experience nausea, switching from tablets to injections can sometimes help, as injections are often better tolerated. Now, there are also less common but more serious side effects that we monitor for. Methotrexate can affect the liver, blood counts, and rarely the lungs. This is why regular blood tests are an essential part of treatment. Before starting methotrexate, we carry out baseline blood tests. Once treatment begins, we monitor regularly to ensure everything remains safe. This monitoring allows us to detect any issues early and adjust treatment if needed. Another important point is alcohol. Because methotrexate is processed by the liver, we usually advise patients to limit alcohol intake. This doesn't necessarily mean complete avoidance, but moderation is important, and we discuss this on an individual basis. Many patients also ask whether methotrexate is a strong or dangerous drug. It's true that methotrexate has been used in higher doses in other areas of medicine, such as oncology. However, in rheumatology, we use much lower doses, and when monitored properly, it is generally safe and very effective. The key point is that untreated inflammation itself carries risks. Ongoing inflammation can lead to joint damage, reduced function, and a significant impact on quality of life. So when we consider treatment, we are balancing the risks of the medication against the risks of the disease. Another question that often comes up is whether methotrexate affects the immune system. Methotrexate does modulate the immune system, which is how it works in autoimmune disease. This can slightly increase the risk of infections, but in most patients, this risk is relatively small. We provide guidance on what to do if you develop signs of infection and when to pause treatment if needed. Vaccinations are also an important consideration. We often recommend that patients are up to date with certain vaccinations before starting treatment, particularly flu and COVID-19 vaccinations. This helps to reduce the risk of infection. Now let's talk about what to expect when starting methotrexate. Typically, we begin with a low dose and gradually increase it depending on how well it is tolerated and how effective it is. You will usually have regular follow-up appointments and blood tests to monitor your response and ensure safety. Over time, as the medication starts to work, you should notice an improvement in symptoms such as pain, stiffness, and swelling. The goal is to bring the disease under control and maintain long-term joint health. Some patients also ask how long they need to stay on methotrexate. This depends on the condition and how well it is controlled. In many cases, it is used as a long-term treatment to maintain disease control. If the condition goes into remission, we may consider adjusting treatment, but this is always done carefully and under specialist supervision. Another important point is planning for pregnancy. Methotrexate is not safe during pregnancy, so this needs to be discussed in advance. If this is relevant, we work closely with patients to plan treatment appropriately. To summarize, methotrexate is one of the most effective and widely used treatments in rheumatology. It works by controlling inflammation and preventing joint damage. It is taken once weekly, requires regular monitoring, and is generally well tolerated when managed correctly. Like any medication, it has potential side effects, but these are carefully monitored and the benefits often outweigh the risks, particularly when treating inflammatory conditions such as rheumatoid arthritis. If you've been advised to start methotrexate and you have concerns, it's important to have a clear discussion with your specialist. Understanding the medication and what to expect can make the process much less daunting. If you found this video helpful, make sure to subscribe for more content on joint health and autoimmune disease. And if you're concerned about your symptoms or would like a specialist assessment, I see patients at Pure Rheumatology London. Details are in the description below. Thank you for watching.